High cholesterol, a major controllable risk factor for heart disease and stroke. These are two leading causes of death worldwide, affecting an estimated 93 million adults in the United States with levels exceeding recommended guidelines. Even more scary is that high cholesterol often has no obvious symptoms. So many people may have elevated levels and not even realize it. That's why it's crucial to be aware of some potential, though uncommon signs that might indicate higher than normal cholesterol. Recognizing these signs early empowers you to take action, such as making lifestyle changes and talking to your doctor about treatment options to lower your cholesterol before it leads to serious health problems. In today's video, I'll cover the top 10 signs that may indicate high cholesterol levels in your blood. I'll explain what these signs mean and when to see a doctor. We're here to empower you with this important health information so you can take proactive steps to monitor your cholesterol and improve your heart health. All right, let's get into the top 10 signs of high cholesterol. 1. High blood pressure, a well-established connection to high cholesterol. When too much LDL cholesterol circulates in your blood, it can gradually build up on the inner walls of your arteries in the form of plaque deposits. This process is known as atherosclerosis. The plaque narrows your arteries, making it harder for blood to flow through easily. This isn't the only danger of plaque buildup. These deposits can also break off and form blood clots that can completely block arteries, leading to a heart attack or stroke. 2. Chest pain. While chest pain can be a warning sign of a heart attack caused by a blocked artery due to cholesterol plaque buildup, it's important to remember that chest pain can also have other causes. High cholesterol increases the risk of plaque buildup and blood clots, making a heart attack more likely. The medical term for chest pain related to the heart is angina. It often feels like uncomfortable pressure, squeezing, fullness, or pain in the center of the chest. Sometimes, it radiates to the jaw, left arm, or upper back. It's crucial to seek medical evaluation for any recurrent or unexplained chest pain. Early diagnosis and treatment are essential for addressing the underlying cause, regardless of whether it's related to cholesterol or not. 3. Rapid heartbeat. Having elevated LDL cholesterol, the bad cholesterol, increases the strain on your cardiovascular system. When LDL cholesterol clogs arteries around the heart reacts by pumping harder and faster to circulate blood through the narrowed vessels. You may notice occasional palpitations or a racing, fluttering heartbeat, arrhythmia, when this restricted blood flow occurs. While anxiety or caffeine can also cause a rapid heartbeat, it's important to note that repeated occurrences could be your heart's way of signaling a problem. A resting heart rate consistently over 100 beats per minute can be a cause for concern, but it's not a definitive indicator of high cholesterol. It's important to consult with a doctor to determine the underlying cause of an elevated heart rate. 4. Fatty skin deposits. One of the less common but potentially visible warning signs that your cholesterol may be high are fatty deposits that develop under your skin, called xanthomas. These bumpy, yellowish growths most often appear on your eyelids, knees, elbows, and buttocks. They form when cholesterol builds up in the soft tissue faster than your body can remove it. Xanthomas can vary in size and sometimes appear wart-like. The presence of xanthomas can be a sign of high cholesterol and should prompt a visit to your doctor for evaluation and discussion of treatment options. 5. Fatigue. Feeling chronically tired and run down, no matter how much rest you get, can be a sign your body isn't functioning optimally. When LDL, bad cholesterol, builds up in arteries, it can form plaques that restrict blood flow. With less oxygen reaching your muscles and organs, you may experience weakness, sluggishness, and fatigue. Even mild physical activity can leave you exhausted. Generalized fatigue and persistent weakness are your body's way of communicating a potential issue. Many conditions, including anemia and thyroid disorders, can cause fatigue. However, if you experience persistent fatigue, it's important to see a doctor to determine the underlying cause. High cholesterol and poor blood circulation can be potential factors, but a doctor can help rule out other possibilities and recommend the most appropriate treatment. 6. Erectile dysfunction. Erectile dysfunction, ED, is a common concern for men. Narrowed arteries can impair blood circulation throughout the body, including the genitals. Erectile dysfunction happens when there's not enough blood flow to the penis to achieve or maintain an erection. Atherosclerosis caused by high cholesterol is one of the most common vascular reasons for ED. When the small arteries supplying the penis become clogged, it reduces the blood flow needed for an erection. Weak or short-lived erections may be an early sign that high cholesterol is affecting your blood vessels, even before more serious problems develop. If you experience ED, it's important to see a doctor to get checked for underlying cardiovascular risks, including high cholesterol. Early diagnosis and treatment can help improve your overall health and well-being. 7. Numbness and tingling. Have you ever felt a numb, prickly, burning, or tingling sensation in your hands, feet, or limbs? This is called paresthesia, which can happen when cholesterol plaque limits blood flow to the peripheral nerves. Poor blood flow caused by a buildup of LDL, bad cholesterol, can cause the nerves in your extremities to malfunction and send unusual sensations to the brain. Numb, tingly, or burning hands and feet are more common at night in bed, or anytime you sit or stand for long periods without moving. This can be your body's warning sign of potential peripheral artery disease, PAD. High cholesterol puts you at risk for PAD by restricting blood flow to the arms and legs. If you experience persistent paresthesia, especially in your extremities, consult a doctor to determine the underlying cause and discuss treatment options. 8. Dizziness. Dizziness can be a cause for concern, but it's important to note that brief episodes of feeling lightheaded, dizzy, or like the room is spinning can sometimes be harmless. However, recurring dizzy spells, especially when accompanied by other risk factors for atherosclerosis, should prompt a visit to your doctor for evaluation. Medical conditions like vertigo or migraine can also cause dizziness. However, experiencing neurological symptoms alongside risk factors for high cholesterol, such as a family history of heart disease or smoking, warrants an evaluation for high LDL, bad cholesterol. When LDL cholesterol narrows arteries supplying oxygen-rich blood to the brain, it deprives brain cells of vital nourishment. Brief moments of dizziness or instability can be an early sign that your brain isn't getting enough blood due to elevated cholesterol levels. 9. Vision loss. Sudden, temporary, and painless blurry vision, double vision, or even vision loss can be signs of eye problems. However, in some cases, these vision changes can be linked to high cholesterol. Here's why. Cholesterol plaques can gradually build up in the arteries that supply blood to the optic nerve and retina. This damages nerve fibers and small blood vessels responsible for clear, focused vision. Vision changes due to high cholesterol tend to affect both eyes equally. It's crucial to see an ophthalmologist to determine the underlying cause of vision problems. While high cholesterol can be a factor, other conditions like diabetes, glaucoma, and macular degeneration are more common causes. Early diagnosis and treatment of any underlying condition can help prevent permanent vision loss. 10. Memory. Some research suggests a link between high cholesterol, especially elevated LDL cholesterol, and restricted blood flow to the brain, which may impact cognitive function. Narrowed arteries due to plaque buildup can limit the brain's oxygen supply, potentially affecting memory centers. Studies have shown that high total cholesterol in midlife may be associated with an increased risk of dementia and Alzheimer's disease later in life. However, more research is needed to fully understand the cause and effect relationship. Brain fog, difficulty concentrating, confusion, and forgetfulness can be symptoms of various conditions, including high cholesterol. If you experience these cognitive issues, it's important to see a doctor for a comprehensive evaluation to determine the underlying cause. Early diagnosis and treatment of any condition affecting your brain health is crucial. While memory loss is common as we age, unexplained cognitive changes warrant a conversation with your doctor about your cardiovascular health. And there you have it, the top 10 signs and symptoms that may indicate your cholesterol is higher than optimal. Remember, getting a simple blood test is the only way to know for sure if your cholesterol is high. Do you have any questions about high cholesterol or how to manage it? Leave a comment below and let's chat. If you found this information helpful, give this video a thumbs up and subscribe to my channel for more health and wellness tips. Don't forget to hit the notification bell so you never miss an upload. If you recognize multiple symptoms on this list, especially if you have a family history of heart disease, Schedule an appointment with your doctor right away to get tested. Finding out early if your cholesterol is high gives you a much better chance of improving your levels through a combination of lifestyle changes, such as diet and exercise, and potentially medication if needed. Thanks for watching, and stay heart healthy!